So today we are going to be talking about sexual and reproductive health, and I'm with Spencer Brandy, my interviewer. Are you the interviewer or I'm the interviewee?
Definitely you are the interviewee. Welcome to my YouTube channel. This is Spencer Brandy. Today I'm with an amazing person over here. Okay, so today Judge Derek is going to tell us more about reproductive health and stuff. Stay tuned. Dr. George.
Yes, Spencer.
How are you?
I'm very fine, and thank you for having me.
Yeah, kindly introduce yourself.
As you have heard, everyone, I'm Judge Derek, and Judge Derek is a happy, enthusiastic, and self-motivated individual who thrives and has pride in whatever he does. And I'm a medical practitioner, I'm a medical laboratory scientist, like Spencer has just said. And I believe that in life, you only get the reward of what you put.
Okay, thank you, George, for the introduction. It was a powerful. So, George, just to go straight to the point, what is reproductive health?
So Spencer, first of all, for us to know what reproductive health is, we have to first of all know what generally health is. And WHO defines health as a state of complete physical, mental, and social well-being, and not generally the absence of a disease or an infirmity or a disability. That is what health generally is. Reproductive health or sexual health, it addresses the reproductive processes, functions, and systems at all stages of life. It implies that people are able to have safe and satisfying, healthy and responsible sexual life. Interpretation of this implies that both men and women are able to be informed and have safe, effective, and affordable birth control, and also have access to the same. So, when we are dealing with sexual and reproductive health, it cuts across all aspects of sexual life at all stages of life.
Wow, that's a powerful point. Okay, speaking about babies and health, and pregnant women, in most occasions you get many women have health issues. At some point, a mother is having diabetes or any other health complications. Does it affect the baby?
When a mother is pregnant, anything that affects the mother affects the baby. So it means that if a mother is diabetic, there is some special treatment that should be given to the mother.
Then what of the case of HIV?
So HIV is a broad aspect in itself, and the thing that I want us to speak about today is STIs in general. STIs are just sexually transmitted diseases, but there is also what we call UTIs, which are closely related to STIs. So UTIs are urinary tract infections. Urinary tract infections are infections that affect the urinary tract system, and they can be transmitted by sexual intercourse, but usually there are other factors that lead to UTIs. But STIs, the difference between STIs and UTIs is that STIs are solely transmitted during sexual intercourse. Sexual and reproductive health is one of the major topics that many people assume because of the African aspect that we have in ourselves. Many people don't want to speak about these things openly, yet they always directly affect us. So when you're speaking about, you asked me about HIV, I want to break it down to you in bits until where I'll reach the HIV bit. So when I was speaking about STIs, there are very many STIs that affect us.
Okay, what are some of the common STIs?
So some of the common STIs include chlamydia, syphilis, HIV, gonorrhea, and the genital herpes, which is caused by the HPV. HPV is the human papilloma virus, and also HPV is one of the most lethal STIs because they are one of the causative agents of cervical cancer. So
Okay.
It is one of the most.
That brings me to a question. Like you as doctors, when you're there in the laboratory, the highest percentage of these STIs, which one do you guys commonly meet?
The one that we most commonly meet. Okay, I can't say there is a most common one, because this topic alone, it is something that most people don't really like. Most people don't really present to the hospital to be tested, and this is one of the aspects that we should encourage people to get tested. But I have met almost all of them, and I can't give the one that mostly appears unless I do some statistics and I have my figures. I'm a scientist, and I don't do guesswork. So unless I do my statistic, then I can present you with real facts and tell you this is the most common one. But again, when you're speaking about prevalence, what you have asked is prevalence. When you're speaking about prevalence of a disease, there are very many factors that influence prevalence, because age influences it, the geographical factor that you are in. For example, here where we are is a campus setup. Here is Maseno. Where I work, there is no institution around. And in where students are together, there's a lot of interaction. So you'll get that a particular STI will be highly prevalent in an area such as here, where students are many. So to answer your question, I can't present that unless I have real facts.
What are the common symptoms of these STIs?
The common symptoms of these STIs, you will feel a burning pain in your genitals. You will see some discharge, like a colored discharge. There is what we call physiological discharge. Physiological discharge is normal in many ladies and many women, because this is a normal discharge. But whenever the discharge now starts to have some color and some smell, this is where now you have to start having some question marks, and you have to start querying whether you have an STI or not. There is also sharp abdominal pains or sharp stabbing pains in the abdomen. For example, in the case of pelvic inflammatory disease, you'll have some abdominal pains. Another common sign and symptom of STIs include things like frequent urinations. When you see blood, you should maybe start querying you have an STI or not. Yeah, and itchiness in the genital area. Apart from burning sensation, there is some
just
itchiness.
To cut you short, is these symptoms, all of these symptoms apply to all these STIs?
No, these symptoms don't apply to all STIs. For example, in a situation whereby you have syphilis will manifest with a painless pimple in the labia. You know the labia is the lip of the genital area, or the head of the penis will have some pimple. And this one, when you see a painless pimple, you definitely start querying syphilis, and you take samples, you go to the laboratory, and we test you to confirm if indeed you have syphilis or not. Gonorrhea manifests with some discharge, some green discharge. So these signs and symptoms always are specific to the type of STI that you have.
Oh.
Yeah.
Okay, that's okay.
But again, in as much as they are specific to the signs and symptoms that you have, remember that in the hospital, we have to get tested for us to confirm if you have an STI or not. It is the testing that will rule out all our doubts. You have to be tested. And testing should not just be done when you have these signs and symptoms. By the way, you know that most people have STIs and UTIs, and they are not even aware of their shortcomings. They are not even aware of they have these diseases. Because most of these STIs, like syphilis, they don't present with signs and symptoms until later stages, when they have advanced and now the infection has manifested fully. That is when now you start having the signs and the symptoms. So it is always good to just have a general health check of your system to ascertain whether you have these STIs or not.
Okay, how often should we go for checkups?
It should be frequently. For example, it can be every month, or after 2 months, or after 3 months, depending on how well you can access a health system.
Oh.
Yeah, but you should go for frequent checkups.
Approximately after how long? Months, weeks?
Just like I said you can go for it monthly, after 2 months, or after 3 months, depending on how much you can access a health system.
Okay.
Yeah.
That's cool. Okay, back to, we talked about pregnancy and the mother with health issues, and you're telling me something about HIV and the fetus. How the chemistry behind it we don't understand actually, because you get the mother is pregnant with the same blood that is contaminated. I mean, how which kind of chemistry happened between, and then the baby end up being negative and the mother is positive?
Thank you for your question, Spencer. And it is very simple. And first of all, you have to have your facts right. So you have to know that when a mother is carrying a baby is not part of the mother. A baby is a foreign being inside the mother.
But
and
I
by
think
the way,
the baby uses mother's blood.
just let me explain. And by the way, the baby's blood and the mother's blood do not mix, though they come under very close contact. In the placenta, the baby's blood and the mama's blood don't ever mix. There is no point that the baby's blood and the mother's blood will ever mix. These are two different beings. The only thing, we have the placenta. The placenta acts as a link between the baby and the mother. So when the placenta is acting as a link between the baby and the mother, there are a lot of things that are exchanged, like food and wastes pass through the placenta. But the blood do not ever mix. That is why it is very possible to have a child who is negative in as much as the mother is positive. But there are situations whereby, for example, there is what we call sensitization. Sensitization is whereby the baby's blood and the mother's blood mixes, but this mix only when there are problems. For example, when there is threatened abortion and there is some sort of bleeding, in the placental bleeding, and also during childbirth, there is a lot of tears and there is a lot of friction, and this is the only time that the baby's blood and the mother's blood does not mixes. So there are ways in which we also help to calm this situation and to arrest the situation. How do we do this? First of all, if a mother is positive, you have to protect your baby at all points. Protecting your baby means you're taking your drugs efficiently and every day for you to reduce your viral load. There is what we call viral load. Viral load is the amount of virus in your circulation, and the higher the amount of virus in your circulation, the higher the rate of transmission to your child, the higher the risk of transmission to your child. So when you're not taking your drugs well, it means that your drugs will not be suppressing the viruses. The drugs that we take act by viral suppression. They suppress the HIV for it not to replicate further. So it means that if you take your drugs well, your viral loads will be kept low and the risk of transmitting HIV to your child is also minimal. So after birth, we also put the child immediately to antiretroviral drugs, ARVs. For example, you have heard of PEP, post-exposure prophylaxis. Post-exposure prophylaxis, whereby you take the drug in a situation whereby you have interacted with someone who is positive. You take the drug for you to help you not get infected. This is what we do to the baby immediately after birth. The baby takes these drugs for up to 18 weeks.
Before you continue, the baby is born negative.
Yeah.
Okay, in this case, why is baby placed under ARVs?
The baby is placed under ARVs because I told you, during birth, there are high chances of the mother's blood and the baby's blood mixing due to the tears and the bleeding that takes place. So this is why the baby must be placed under ARVs. And also, when the baby will be breastfeeding the mother, you know, a child who has been born must breastfeed. There's that risk of transmission. So you must put the baby under these drugs for you to prevent the baby from getting infected from the mother to child transmission.
Okay, about these cases, actually rising cases, pregnant women die of hypertension, and you said in some ways, they don't mix, the mother and the fetus. Like, what happens in the process?
Now when you're talking about hypertension and pregnancy, these are totally different things. Hypertension is a totally different topic. But when a woman is pregnant, there is risk of developing pregnancy hypertension. Because like I said, the baby is a foreign being in the body, and the body will always try to fight any foreign being in it. So the mother also, these are some of the situations that take place, so that you develop hypertension, you develop diabetes, gestational diabetes. All these things you can develop them during pregnancy. But all these things, the good thing is that there are ways in which we can take care of these things, and you can have a successful pregnancy.
Wow. Okay. Currently, there's high rise of abortion cases, more so in schools. Ladies who are not yet married and stuff. What do you think is contributing highly, majorly, to this act?
So the reason why we have sexual and reproductive health is for us to make informed decision. There should be nothing like unwanted pregnancies. All pregnancies should be wanted. So the reason why there is high rise of abortion cases is because people are not exposed. They don't have the education they need. They don't have the access to information and know the various birth control methods that are around. They are making an informed decision. That's why there is a rise. Because if people could always know that, hey, there are condoms here which we can use, they will be preventing this pregnancy, and they can know that there is this pill here that I can take and prevent this pregnancy. These situations of abortion will not be on the rise. Yeah, so I think the main reason why there is high rise of abortion cases in campuses and many schools is because of lack of access to information, the ignorance that surrounds them, and also generally people are just careless. If you inform them, if you teach them, if you have this health education and you tell them the importance of sexual and reproductive health, and they will now be able to make informed decisions and also have a very healthy and enjoyable sexual lifestyle.
Still talking about abortion, many youths prefer unsafe abortions to safe abortions. Can you tell us ways of safe abortions and unsafe abortions? Which ways are recommended and which ways are not recommended?
So to speak of that, in Kenya, abortion practice is governed by laws and regulation, and it is contained in Article 26 of the Kenyan Constitution, Section 4. And it gives us a limelight on when to carry out abortion. For example, if the health of the mother is at risk, it is allowed to carry abortion. But again, speaking of the abortion practice is only safe when it is done by a qualified and licensed health practitioner. That is when you can have a safe abortion. But abortion whereby you go to the chemist or somebody gives you pills and you take them, it predisposes you to very many risk factors, and you can even die when you don't follow the proper channel of abortion. So I think that in campus, people always prefer these unsafe abortion methods because they are looking at the price, but again, while looking at the price, they end up sacrificing their own health. Because you can go and take these pills, then you have a hemorrhage. A hemorrhage is excessive bleeding. You can bleed to the extent whereby you don't have any more blood in your system, and this one will immediately lead you to what we call hypovolemic shock. And when you have hypovolemic shock, you'll automatically die.
Okay, so is there any way that the government can use to curb these unsafe abortions? You get so many young youths sorting to go to the chemists.
I think we cannot put all the task to the government, but right here, me and you, there is what we can do by proper education we can go for campus tours and educate these young ladies and young women on the safe abortion methods. We tell them that, hey, there is this. By the way, right now, there are a lot of agencies that have come to place that help women undergo safe abortion practices. Yeah. And by the way, me, I believe that if you're not ready to have a baby, then there is definitely no reason of you having a baby. That is why I always advocate that you should always not have unwanted pregnancy. all pregnancies that you are having should always be wanted, and you can only achieve this through proper health education. When you are educated, you will be able to make informed decisions.
Okay, speaking about that, what are these contraceptives that we can use as youths to avoid pregnancy, now the unwanted pregnancy?
So there are a lot of contraceptives. We have the pills. Okay, by the way, we have the permanent methods and we have the temporary methods. So the permanent methods, like for me, like for the male, I can go for vasectomy. Vasectomy means I cut my I cut my vas deferens such that the sperm is not able to flow. That will it is a permanent method of contraceptives. For the ladies, there is what we call hysterectomy. You can remove the uterus. Whenever you remove the uterus, it means that there will be no any pregnancy. But us as young people, what we majorly want is not to have permanent methods. We only want to have these pregnancies at the right point in time. So this will take me to the temporary methods. The temporary methods, we have the pills. Yeah, we have the injectables, and these are hormonal methods. Most of these temporary methods are hormonal methods. The hormone here is progesterone and estrogen, and they come in different degrees and different forms depending on the period in which you want them to last. We have the long-term methods, by the way, like the implants. You can have the one for 3 years, for 5 years. Yeah, there is also the implants, like I said, there is the implants. Yeah, there is the injectables, like the Depo-Provera. You have heard of that? Yeah. Then we have the pills, the everyday pills. Yeah, and also we have spermicides.
Let me just cut you short. About the morning pill, how dangerous is it?
The P2.
Yes. Because I was hearing like if you use it continuously, maybe it can affect you.
Okay, that is not a topic that I really don't want to dwell in so much. But of course, these are hormones, and excessive use of anything is always dangerous. But most of these things are myths and misconceptions. But I want to believe that the morning after pill should not be used excessively. Excessively here, I cannot say what amount because I don't have the facts. Yeah.
Okay, back to contraceptives. You said which ones are the best? The recommendable ones?
There is no best and there is no worst, Spencer. What pleases you when you go to a health practitioner, and you will be advised accordingly, and it will be up to you to make an informed decision which one you want. Yes, they have effects, like it can lead to body loss or body weight gain, all this, but the end justifies the means. The overall thing is that you don't get that unwanted pregnancy, and it should also act such that whenever now you are ready, you should be able to get that pregnancy when you are ready.
Okay, still speaking about abortion, what are the methods of abortion?
So the methods of abortion, we have the pills, the pills whereby you take the pills, and the abortion will automatically take place after maybe some few hours. You'll start here feeling some abdominal pains and contractions, and there is also what we call the aspirations, the vacuum aspiration. So vacuum aspirations can be manual or electric. We have the manual vacuum aspirations such as the MVA, which is also commonly called the MVA. Then we have the surgical abortion, whereby we surgically remove the baby from your uterus.
So that mean you have to cut our stomach?
Yes. Yeah, to remove the baby. And these methods depend on the age of pregnancy. The age of pregnancy. For example, when the pregnancy is still around 8 weeks, it is good to go for the pill method. After 8 weeks, the vacuum aspiration method is good. That is up to 12 weeks, and onwards, it is good to go for the surgical removal of the baby.
Derek, how do we calculate safe days? How do I know as a lady that, okay, right now I'm in my safe days? Like, how should we calculate the safe days?
So to answer your question, first of all, I thank you very much for that question. It's a good question. So for you to calculate your safe days, there are some things that you have to consider. There are some scientific facts that you have to consider. First of all, you have to know that not all women have the same cycle. Cycle vary from 14 to 35 days. So you have to first of all know your cycle. How do you know your cycle? You will count from the first day you see the first drop of menstruation up to the next time you will see your first drop of menstruation. Are we together up to there? That will be your cycle, and it can vary 21, 35, 18, it depends. 21, 35, it depends. But a normal woman has a cycle between 21 to 35 days. So another thing that you have to put into consideration is that sperms is able to stay in the vagina for up to 5 days. It is 3 to 5 days, but let us use the maximum, which is 5 days, to avoid any doubt. And you should also know that the ovum is viable for only 24 hours. So fertilization, whereby you are now getting pregnant, means that the sperm is present and the ovum is also present, and they meet, right? There is what we call the luteal phase. The luteal phase is the only constant thing for all women. The life cycle can vary, get it? But the luteal phase is always 14 days for all women. So it is these 14 days that will help us calculate the safe days. So when you have known your cycle, for example, you have known that your cycle is 28 days, right? So what you will do, you will count backwards 14 days to know the time that you are ovulating. So let us count with you. If your cycle is 28, let us count backwards 14 days.
That is 14.
Your cycle is 28 days. Let us count backwards 14 days.
Okay.
We know the time that you'll be ovulating.
27.
So 28, 27, 26, 25, 24, 23, 22,
21,
20,
19,
19, 18, 17,
16,
16,
and then 15.
15. So it means that you'll be ovulating at day 15. So at day 15, like I said before, sperms is able to stay in the vagina for how many days?
5 days.
So it means even if you have sex 5 days before day 15, you will get pregnant. Are you getting me?
Yeah.
So it means that from 5 days before day 15 is
It's
14, 13, 12,
12,
11,
10.
10. So it means from 10 to 15, if you have sex, you are very unsafe. You are likely to get pregnant. And I told you that the ovum is able to stay for how many hours?
24.
24 hours. So let us add one more day to day 15. So that is 16.
16.
But to give it the benefit of doubt, let us add 2 days. That is 17. So it means from 10, if your cycle is 28 days, from 10 to 17th, you are highly likely to get pregnant. It therefore means that the rest of the days is
Okay. That was very educative, I have to admit. And
so
thank
you
for
just first
clarification.
of all have to know your life cycle. It is not always 28. That is where you go wrong. Every person has a life cycle. Yeah. So you count from the first drop you see until you finish, until the next time you see the first drop. That is how to calculate your cycle.
Okay.
Yeah.
Okay, thank you so much. Okay, just to finalize, what is the importance of sexual reproductive health?
So sexual and reproductive health, it is an element that gives us the power to decide and make informed decisions and have safe and satisfying sexual lifestyle. With the sexual and reproductive health, we can decide when you want to get a baby and how you want to do it. So it gives you the power to make decisive decisions. It also helps you to generally maintain a healthier lifestyle, because when you have the access to sexual reproductive health, it means that you will be staying away from STIs like HIV. And like I said before, sexual and reproductive health, any impact that you have even at a young age, it affects you all your lifestyle. For example, you contract HIV at a young age like here, it will be affecting you all your life. And also maybe you get pregnant, let alone HIV, maybe you get pregnant at this stage of life. You can see that you'll have the baby all your life. So it is good to have this education and make informed decisions. And also, sexual and reproductive health helps us in planning. We are able to plan for the future.
Okay.
Yeah.
Okay, thank you so much. I have to say it was good interacting with you. You've given us very powerful messages, and you know we can't take it for granted. Maybe if you can just finalize on, talking to the youths of these important things.
So what I can say as I finalize is that let us make informed decision. Let us access. Nowadays, you can access information anywhere. You can use the internet, exploit the internet to know these things, make informed decisions, and generally maintain a healthier lifestyle whenever you are having this sexual lifestyle. This is a topic that many people don't want to talk about, but we have taken the initiative to bring it to you because we care about you and we want you also to pass this message to other people.
Thank you so much. It was nice hosting you, and it's really educative, I have to admit. Thank you so much, and please next time if we call you, just come back.
Yeah, it was a pleasure also having you. I've enjoyed the whole interview. It has been a very nice interactive session. And by the way, don't forget to subscribe to Spencer's channel. You just tell them the name.
Yeah, Anyango Brandy Show.
Anyango Brandy Show. And also my channel, George's Solutions. The link is down there in the description. And also, if you haven't hit that subscribe button, this is the point whereby you hit that subscribe button. Thank you, and that's it.
Thank you, and bye-bye until next time.